This is Delhi. Please stand by for our next program. This is All India Radio. In our national program of talks tonight, we bring you a panel discussion entitled Depression, Climbing Out of the Pit. The panelists are Dr. Jayanti Dutta, well-known clinical psychologist, Apoorva Saxena, yoga and meditation guru, Shivani Pawar, nutritionist and emotional wellness coach, and Vickram Bahl, media personality who initiates and moderates the discussion.
Welcome to the national program of talks. Mental depression. It is perhaps one of the most widespread disorders across the population of the world and can be mild enough to just give one a feeling of being low once in a while or severe enough to cause suicide. However, in all cases, it robs the sufferer of a good quality of life. That is why it is so important to seek proper medical attention as soon as it is detected. But such mental disorders are difficult to recognize by others and usually have two barriers for the sufferer. First, accepting the problem, and second, seeking help for it. That is due to the stigma attached to mental health in many cultures. My guests today are going to throw some light on recognizing depression and climbing out of the pit. I have with me in the studio Dr. Jayanti Dutta, well-known clinical psychologist, Apoorva Saxena, meditation and yoga guru, Shivani Pawar, a nutritionist and an emotional well-being coach. Welcome to you all. I'm going to start by putting the problem in perspective. The World Health Organization has stated that depression is a common mental disorder. Globally, it is estimated that 5% of adults suffer from depression. Depression is also a leading cause of disability worldwide and is a major contributor to the overall global burden of disease. More women are affected by depression than men. Depression can lead to suicide. However, the good news is that there is effective treatment for mild, moderate, and severe depression. Jayanti, I want to start with you. What is the situation in India, especially now in the post-COVID era, where depression, some say, has in fact gone pretty high?
It is. It's worrying me also because now depression is found across all ages, even among the children. I'm handling cases where the children are affected with depression. And, when you feel sad, you feel a little disturbed. That doesn't mean that you are depressed. When you feel a little low and people come up, I've been feeling depressed. Well, that's not true.
So there's a distinction between clinical depression
and feeling sad.
Just feeling sad
low.
or low.
Yes. If you've been feeling sad or low and your energy level is affected, your sleep is affected, your appetite is affected, and you're surrounded with hopelessness. I cannot do anything. I don't think I should be looking forward to tomorrow. And then ultimately, somewhere the suicidal thoughts also sip in. And if it is lasting for more than 15 days, yes, you ought to take a professional opinion about it. Now, when somebody comes to us complaining with all these symptoms, we just don't listen to him alone. We have psychodiagnostic tests. We administer those tests and we see whether it is really depression or not. Depression can be also various types, It could be bipolar. It could be seasonal affective disorder. Now the season is changing, Very often you come across cases during the change of the season where, they have been keeping all right, everything was fine. All of a sudden, they've started feeling low because of the lack of sunlight.
Yes, we'll come to that,
Yes.
The different types of depression and the role of nutrition, of sunlight, of exercise. But,
I'll just end it with, it is treatable. The onset has to be seen, whether it is insidious or it is acute. Acute depressions can be immediately treated. Insidious, you'll have to take probably the medicinal intervention as well.
Just one thing, Jayanti, you mentioned there that if it lasts more than 15 days,
right.
But in case of thoughts or in case of any recognition that somebody is contemplating suicide, I think then that is an emergency. That would need immediate intervention.
That needs a crisis intervention. That needs immediate intervention because suicide, whenever the patient is contemplating suicide, it happens within few seconds. See, the crucial decision, plunging into this, taking the action, it happens within few seconds to few minutes. And here we try to give crisis intervention first.
So let me just finish off with this very important part first before we go on into the program. If somebody is having thoughts of suicide, What is your advice to them?
Don't take it lightly. Please look into it. Seek professional intervention, professional help immediately.
To
Don't
recognize
try-
early
Yes,
signs.
Absolutely.
Apoorva,
And-
let me bring you into this right now on meditation and yoga. Now, in your own practice, you've probably seen a change take place post-COVID.
Yes.
What exactly has it been like?
So people have become more aware about their mental and physical health, especially mental health, because we got a lot of cases of anxiety during the lockdown. And our online classes were on where we gave a lot of meditation sessions, especially for people who were suffering through anxiety. And our classes always make sure that if it's a yoga program, now first of all, meditation is not different from yoga. It's under the umbrella term yoga. Meditation is a part of yoga. So it comes with every class of postures, breathing, and then meditation.
So let me rephrase that and ask you, when you're looking at mental health
Yes.
and you want to positively impact the mental health of somebody, obviously you are looking at the physical side of it and how you could increase the physical activity either through meditation or through yoga or even, I would say, through aerobic exercises, because they release endorphins, and endorphins are considered to be
Yes.
antidepressants,
Right.
your body's natural
Right.
antidepressant.
Right.
So what is your formula? If somebody is feeling low, not necessarily clinically depressed, because that would need medical intervention with medicines probably
Right.
to rectify the balance first.
Yes.
But if somebody is feeling low and loosely, as he says, I'm feeling depressed.
We actually give them breathing exercises. We start with breathing exercises and we help them release a lot of anxiousness through the breath. There are pranayams like Nadi Shodhan pranayam. There is a candle blow breathing technique which helps in reduction of anxiety and people who are feeling low. And when we do postures, when we do asana, it's a connection of mind, body and breath. So we train the mind by bringing the awareness on the breath and the body. Then the mind has no scope to think about something else or feel low. The entire focus is on their body, how to balance it on one leg.
Apoorva, I will just try and put another perspective to it.
Right.
People who are in any case feeling low suffer from a lack of energy and don't feel like even doing something like meditation.
Okay.
They find it difficult to concentrate.
Right.
And one of the methods to, as they say, push them out of that lethargy would be to get them to do aerobic exercises first. Is that what you do?
No. I actually start with the breathing and then I take them towards the postures. Sometimes they don't have that kind of energy to just the asana. They start with breathing exercise and gentle movements like Pavan Mukt Kriyas or warm-ups and rotation. I move them to aerobic exercises when I see the energy rising a bit, when they're feeling more better. But we also take the help of music, chantings, lot of chantings like Om chanting or any mantra we take. We start with those chanting sessions and then they start feeling better. Another point which we are missing here is endocrine system. Endocrine system is responsible for a lot of mood swings, anxiety, and that the imbalance there in any hormone, like if someone has PCOD or thyroid, so it does affect the mood system. And if it's not taken care, it leads to depressive state as well. So with postures, we take care of endocrine system and we help in releasing positive hormones. We work on balancing the pineal gland, where very important hormones are released, especially dopamine and endorphin. So with postures, they are able to do that and it becomes an addiction to them and they don't miss a single class.
So that's interesting, Apoorva. You talk about the various factors that balance out in a person's body to keep the emotional state good. Let me bring in Shivani here now. Shivani, you look at food and vitamins and supplements and various other ways and means of balancing the person's emotional state. There is one area which people have been studying to some extent recently, and that is how they can give supplements such as omega-3 and various other vitamins to change the mood of a person. And usually what happens is people go for what you call comfort foods. Sugar is one of the things that gives you comfort. And I believe that is not the right thing to do. What's your opinion?
Well, when someone is feeling low or feeling sad, of course, food is something which comforts them emotionally. And my uptake on that particular thing is that whatever that you are eating can, of course, cause a lot of stress into your body if you're eating the things which I'm about to say next. And the food which are actually worsen the situation when it comes to stress and anxiety are few, but can cause a lot of stress when it comes to increasing the level of cortisol hormone, which is a stress hormone.
So which foods do you recommend and which foods do you not?
Okay. So, of course, on top of that, junk food, because it leads to high glucose body sugar level.
So when you say junk food, you mean high trans fats?
Trans fat, processed
high
food
sugar.
item, cookies, biscuits, pizza, pasta, burger, all sort of stuff. Along with that, alcohol. Some people take alcohol to release stress. But again, it causes a lot of stress into the body. The other thing, which is caffeine. A lot of time when people are stressed, they took caffeine, coffee. But that is again can cause a lot of stress into the body.
So what is your suggestion on vitamins and omega-3 and other supplements?
So there are 4 important things when it comes to supplements, nutrition. So 4 nutrients which are focus when it comes to planning diet for someone who is feeling stressed or anxious. So there are 4 things. So the first is magnesium. So magnesium is a nutrient which is very, very essential when it comes to calm down the nervous system. And the food items which are rich in magnesium, there are fresh fish, fresh green leafy vegetables, some nuts and dairy products. Along with that, people can also take magnesium supplements because sometimes not everyone can take all these things when it comes to filling up the nutrition gap.
Apoorva, there's a study done that says that if you over-exercise, it can actually cause anxiety and even depression, a downer effect. Is that something that you look at?
Yes. So I've come across some cases where some people used to overwork out. Sometimes they used to repeat more than one batch during the workout. They used to ask, ma'am, we want to work out 2 hours or 3 hours a day. Because it gets like, they get finicky, they get obsessed about looking good and looking thin and looking pretty. Recently, I spoke to someone and she said she had a lot of peer pressure. All her friends looked good, felt good, and they were very fit and they want that chiseled abs body to feel beautiful about themselves. So they developed that obsession of working out, overworking out, and that led to fluctuation in their heart rate, stress, hypertension, and anxiety. So this is a case where they do not leave the treadmill, they do not leave
too much
cross country. Yeah.
Too much of anything is bad.
Yeah, very bad.
Jayanti, in fact, one of the reasons why people avoid going to a doctor, especially when it comes to a mental problem, is the stigma. They worry that what will the world think and they'll be labeled as mental patients. In the current scenario, do you think people are now coming out of that in India? And do you think there is enough of medical privacy prevalent?
Yes, of course. Medical privacy is prevalent and people are coming to terms now when you are so much in trouble that your day-to-day life activities are affected, your work-life balance is disturbed, then you have no choice but to seek help. And the people have started opening up. There is a lot of awareness, especially after COVID. The things have become so rampant, you have no choice. Everybody is talking about it and the stigma is slowly going down. But I would like to say about a couple of things like the types I tried mentioning before. Depression could be of various types. It could be psychotic, it could be neurotic, it could be even, people have this kind of a wrong idea. Depression means slowing down the psychomotor activity. No, it could be agitated depression also. Sometimes because of pregnancy also, you mentioned earlier that the women suffer more from depression. Why? Because there is a connection with hormones. See, when you have menarche,
postnatal depression.
You have premenstrual syndrome, you have postmenopausal syndrome, then you have post-pregnancy also the depressions. So these are the things, for which the ratio goes little topsy-turvy.
And most sensitive people are probably prone to depression? Is that also the
Not
case?
really.
No, so,
not really.
So it has nothing to do with being sensitive
not at
or
all.
being strong
Not at all.
or
Each
strong-willed?
individual has his or her own stress tolerance capacity. Depends. You see, when you talk
not
about
just
mental
a
health...
capacity, but it's also a question of a trigger.
Yes,
So there
and
are
then the
certain
supportive
triggers.
environment. If you have a supportive environment, we've been talking about the hormones. I would clearly like to mention about a couple of things. Dopamine is one of the very important hormones. It's a feel-good hormone. You feel good when you go for shopping. You feel great when somebody is praising you. Even when the child comes back saying that ma'am said such good things about me. When you were conducting this interview, we all feel great. You're doing a very good job. So we are, in fact, stimulating your dopamine. Then you have serotonin. Serotonin plays a key role in countering anxiety and depression. So what is the way, like Apoorva said? Exercise. And of course, a good sleep. If you could take a good sleep, very often I've seen people who say, "Nee, I'm feeling sleepy now, but why should I sleep now?" that means your circadian rhythm is disturbed. When you feel sleepy, if you have a good half an hour's nap at any time, please go ahead, because it will help your serotonin uptake.
The power nap, as they call it.
Yes. And then you have endorphins. Endorphins, like you mentioned also, it's a runner's high. It's a natural painkiller. And the endorphins are released when you do the proper kind of exercises with the advisors.
So you mean a proper type means that you need to do aerobic exercises which would get your heart rate up,
not only that, very often when you are suffering from depression or depression has set in, you start negating everything. You suggest anything to the person, "Mere ko nahi karna, I don't want to do it." In that case, we use mindfulness. This is where, again, we regulate the breathing. You don't have to get out of your house. Wherever, find a soothing corner, find a comfortable sitting posture, sit there. This is related with positive imagery. So the patient who is not wanting to get out of the bed, give him a comfortable stature, let him get into mindfulness, start positive imagery, and you will see slowly it brings about the oxytocin.
Let me just get in Apoorva here.
All right.
How do you get somebody out of that mold where he is stuck? And as Jayanti just said, you have to bring them to the point where they come into mindfulness.
Yeah.
These are all different techniques leading to the same goal.
Right.
Now, how do you actually get them to the first step?
Right.
To say, yes, I'm willing to do all this? Because the general feeling is that once a person is in depression or is very low and not into clinical depression, they do not wish to
exercise or come out of the house.
They don't want wish to do anything.
Anything, yes.
It's not just exercise.
Yes.
They don't want to go to work. They don't want to bathe. They don't want to meet people.
Yes.
They don't want to talk.
They don't want to talk.
So I introduce music.
Okay.
I play music.
What
in
type
my
of music?
So I play chill out ambient trance music, which helps them soothe and calm down their mind. And then, despite of making them hold postures, I make them flow. I make them move slowly with the postures and ask them to breathe in a particular manner. And like ma'am said, very rightfully, mindfulness is something which I always teach them. So I tell them that today you will not look at the phone while eating food. Today, while taking a shower, you'll feel the water coming on your head. You'll feel this, you'll listen to the sound of the droplets of the water. If you're eating food, you'll count the number of bites you're eating. You'll drink the water. You'll feel the water gulping through the throat. Whatever you do, do mindfully. And if you're not feeling good about yourself today, look at 5 things around you. Look at the wall paint, look at the fan, look at the books, look around yourself. Feel the breeze. If there's any air, if there's AC, if there's fan, feel the breeze touching your skin, touching your hair. Bring awareness. And that's how they snap
Shivani,
out of it.
If I may just bring you in here, is there any food or supplement that could give relief from that terrible low and bring people at least to the point where they can be more mindful, as Apoorva just said, or like Jayanti said, start seeking more exercise, more endorphins are, of course, the next level because they have to get down to running or doing some sort of aerobic exercise. So is there some diet that you would recommend them, which would bring them on track, at least to start?
Yes. So as I was talking about the 4 important nutrients, one being magnesium, and the second very important is vitamin B. So vitamin B again helps in when it comes to calm down the nervous system. So there are 11 kind of vitamin B, but not every vitamin B can be absorbed in the body. So here comes the B complex. So people can take B complex supplements. And when it comes to food, of course, it can be taken as whole grain, egg yolk, nuts, meats, fish, and green leafy vegetables. And the second thing is vitamin C. It is again very important antioxidant which helps in killing the free radical which is caused by stress. The examples of vitamin C can be berries, citrus fruit, capsicum, broccoli, spinach, tomatoes, and radish.
And what type of food would you suggest for people who are having sleeping trouble, who are not having good sleep?
Okay, so first of all, when it comes to not having good sleep or not sleeping properly or even sleeping but having a disturbed sleep, so it is again related to the activity that they're doing in a day. Maximum time people are not doing any activity that cause a lot of a disturbance in the sleep. So it's very important, not just when it comes to diet, but it's very important to actually being busy, doing something that you love. Second thing, the food, eating food which are rich in proteins and vitamins.
A lot of people like to have many cups of tea or some cups of tea during the day, and it's very relaxing for them. So what is your view on that?
Okay. Of course, tea is something which gives you comfort and a feeling of happiness, and sometimes it connects you with people. So people like to have tea. But I would suggest do not take tea more than 2 or 3 cups in a day. And the best thing that people can have with tea is having some healthy snacks. Introduce some healthy snacks like nuts and seeds, such as sesame seeds, pumpkin seeds, sunflower seeds. They're again rich in vitamins.
And what about switching from the standard tea to maybe some different types of tea?
Yes,
What about chamomile
I was about
tea?
to come up to this. That is green tea. Again,
And
green
what about
tea
chamomile tea?
Yes, I was about to say this, especially chamomile green tea. Chamomile is again helps in reducing the stress level. But if someone is taking it around the bedtime, it will also help in sleeping better. So chamomile can also help in managing the stress.
Jayanti, the problem today is that the younger people, at least, don't realize perhaps that they are going through a lot of stress or depression, which may not be clinical depression, but a downer. And the parents may, or the seniors may recognize it, but they don't know what to do about it.
The trouble is, we've been talking about, what all instructions to be given to a depressive patient. Very often when patients come to me, they are not willing to talk. They don't want to respond. And this is where the problem starts. So for us as clinical psychologists, psychotherapy plays a great role for saving the life, not only of the patient, but also of the family. Here, rapport formation becomes very important. So our whole concentration is on how to make the patient comfortable and make the patient open up slowly. And believe me, suicidal cases, when you bring them back, it takes little time, it takes little dexterity, but they do come round. Then you can introduce all this scheduling and the food. Food, I found omega-3 helps, and vitamin D. SAD, I talked about, seasonal affective disorder. In such cases, we advise the patients to go out into the sunlight for a daytime, limited amount of
So
time.
they can get vitamin D in.
Yes. And then...
But then they have to expose their skin, because going out fully clothed like people do in winter.
No, we don't ask them to go fully clothed. We ask them to enjoy the sunlight, because that is the treatment for SAD. That is the seasonal affective disorder. And the minute it starts triggering, we ask them to have proper illumination in the rooms, proper illumination in the house. And the most important thing, which is a very cardinal component for handling the scenario of depressions, is having that social networking. If you encourage your patient to have a social networking, get out of the house, there is a kind of a cyclical thing which they have in their environment, and they get dragged into it. So they develop negative things with the liaising of the family members. So when you ask them to break that, get out of the house, bond with some other people, that also helps them in oxytocin. So all these hormones, the happy hormones, when you talk to somebody, when you get out, when you listen to somebody else's story, you forget about your own self. This is a very important component. To get the patient to listen to you, you must introduce these channels, because these channels were not accessible to the patient. So when you give this support thing, you see that these are the venues, this is how you can get out. And then, of course, you start with exercises, and then your breathing comes in, mindfulness comes in,
Apoorva.
and the patient falls in line.
Apoorva, do you have these sessions of group sessions, like Jayanti is saying, where the group comes together?
Yes.
Do you find that more useful, or do you think sitting at home and doing it on a screen is also good?
If it's inaccessible to reach a studio and the yoga studios are far off your place, online is the best option. But anyway, I consider offline yoga classes very effective, because I've been taking these classes for 10 years now, and the group of ladies come, then they talk together, they share their issues, whatever they're going through at their home.
That helps.
Yes,
That
so
helps.
it helps them express, it helps them release their stress and anxiety.
Not only that, it helps them bonding also,
Yes. So they
Well,
form
if I may
a
just
social
add,
bond.
but they can also have a negative side to that. So too much, as they say, of anything is bad.
Yes, so if
Do you
it
agree,
exceeds-
Jayanti?
No, I don't. I have not come across any group of ladies cribbing about all other things and enjoying it. They don't really go out unhappy. They go out
They go out
very
happy,
happy.
yeah.
Because there is
Very
a lot
happy.
of we have defense mechanisms,
Right.
and nothing helps you more than displacement. When you say, oh my God, today my day got spoiled because of, you know what, I saw the face of that person. So this is displacement, this is attribution. When the ladies get together and talk about this, you will never see the ladies talking about very highly positive things in their life.
No, they actually
do come up with the ventilation.
They do talk about
so
positive
Apoorva-
things.
Yeah, but the ventilation is very important.
Yes.
So Apoorva, that is something you actually look at through your classes to help them vent their feelings?
Not during the class of yoga,
but through
while
interaction.
yes, through interaction. If I see some students really disturbed and upset, I talk to them, and I try to go out of my way to understand why they are looking stressed or feeling upset or feeling low. And I take a group of 10 to 15 ladies, 4 to 5 batches, and I've noticed one thing: they feel really good when they talk while doing the exercise, or they discuss their issues with each other. So there's a lot of happiness. They go with the positivity. They go back to the house with a smile, and they tell me, ma'am, this 1 hour of yoga class, we are so happy. We meet everybody. We meet people who are our same wavelength, who think like.
So
what
it's a
you
very
said is an
critical
interesting
scenario.
part, that it's the interaction that matters. I want to get in Shivani here. Shivani, you're also an emotional well-being coach, and that is in addition to your being a nutrition specialist. What exactly do you do? How do you coach people in their emotional well-being?
Okay, so basically, of course, that is something which I have learned with my own experience with anxiety. And then I realized that, of course, there are so
When
many
you said your
people-
own experience with anxiety, that means
Yes.
you personally were an anxious person who...
I have suffered from anxiety for more
Right.
than 5 years.
So it's
and
your
I have
personal
been-
experience.
Yes, I have been diagnosed with generalized anxiety when I was 21-year-old. And since then, I have realized that when I was into that particular field of dietetics and, of course, helping people with their nutrition, there are so many people which I met with having same experiences and having similar feelings. Then I realized that, of course, that is something which I need to work on myself. When I have learned all these things, then I realized that I need to teach them. So when it comes to emotional well-being, I teach people how they can understand their emotion and how they can regulate them. Of course, there are so many things which I do, which I have learned. And as per Dr. Apoorva ma'am and Dr. Jayanti is there. So, of course, I'm learning so many things again. And this is something which I have incorporated in my program also.
Okay.
So, meditation, mindfulness, along with diet, proper diet, rich with omegas, vitamins and all everything, I recommend them. That is the wholesome, you can say, wellness which I provide to my clients.
So I think we all agree on one thing, that it's a holistic approach that is needed. A medical intervention is very essential in cases where it is a lingering problem, or an immediate medical intervention is needed if there are any thoughts of suicide, or if there's anybody who you think is contemplating suicide.
See, I would say
Absolutely.
professional intervention, because when it is suicidal, you very often need what I mentioned as a crisis intervention. So it varies from individual to individual, age group to age group, and the type of depression the patient is suffering from.
Right.
And how crucial is this intervention. Sometimes, you need to provide a community support also in such cases. And then we take the help of the community nursing as well. So it is a professional intervention who is a very crucial component for handling the depression, not always medicinal.
So that's where we have to leave it today.
Yes.
And as Jayanti said, professional intervention is something that you must consider if the problem is bothering you. Thank you, Jayanti. Thank you, Apoorva. Shivani.
Thank you.
Thank you all so much.
Thank you.
Thank you all for tuning in.
In our national program of talks tonight, you were listening to the panel discussion entitled Depression, Climbing Out of the Pit. The participants were Dr. Jayanti Dutta, well-known clinical psychologist, Apoorva Saxena, yoga and meditation guru, Shivani Pawar, nutritionist and emotional wellness coach, and Vickram Bahl, media personality, who initiated and moderated the discussion. Produced and presented by Naveen K. Gupta of All India Radio Delhi, this program came to you from the Delhi station of All India Radio.